Treatment tips for severe chronic heartburn. Limit alcohol. Alcohol can relax the muscles around the lower end of your esophagus, making it easier for acid to bubble up. Stay slim. One study found that overweight people who lost weight were more likely to have their heartburn go away. Another reason to lose weight: you'll respond better to heartburn medications. Wear loose clothing. Tight clothing, including belts, can cause stomach contents to push upward. Relax. Stress causes stomach acid to bubble up. Treatments: if you have chronic severe heartburn, you may need medications. Both over-the-counter and prescription drugs are available. Antacids are usually the first type of drugs doctors recommend for chronic heartburn. You can get them over the counter. They work by stamping out the acid in your stomach. Antacids work right away, but they don't last long. They also don't help a damaged esophagus heal. Look for products that have both magnesium and aluminum salts. They're less likely to cause diarrhea and constipation. H2 blockers are available over the counter and by prescription. Although they don't kick in as quickly as antacids, they last longer. They work by slowing down how much acid your stomach makes. They include cimetidine, Tagamet, famotidine, Pepcid, and ranitidine, Zantac. Proton pump inhibitors (PPIs) also block acid production. You can get them over the counter or with a prescription. You may need more than one type of medication. Talk to your doctor about the best treatment plan for you. Make sure you're aware of the side effects of all the medication you take. Surgery. The most common surgery for extreme heartburn is fundoplication. The surgeon wraps the top of your stomach around the bottom of your esophagus to strengthen it and help keep the acid where it belongs. This often can be done laparoscopically. It involves only a small cut and typically lets you go home in 3 days or less. Endoscopic treatment. The goal of this treatment is the same as surgery. But instead, your doctor puts a thin tube called an endoscope down your throat and into your esophagus. He then uses stitches or heat to create scar tissue to tighten the sphincter and stop stomach acid from leaking. Newer treatments involve using implants, almost like a retaining wall, to keep acid from seeping out of the stomach. There's not a lot of information yet on how safe they are or how well they work in the long run.